Hello, and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a certified family nurse practitioner and a certified nurse midwife in Santa Fe, New Mexico. I'm the owner and the operator of EverCare Family Practice, where we specialize in family health care for men, women, and children, bioidentical hormone replacement therapy for men and women, as well as aesthetics for men and women. Today, I'd like to finish up a podcast that we were discussing this last week on allergies. The podcast was running a little bit long, so I decided to stop before talking about complications of untreated allergies. So that's what I would like to discuss today, and I want to thank you for joining us for the podcast. So last week I talked about allergies, symptoms, treatment options, including immunotherapy, as well as herbals and over-the-counter treatments, as well as prescription medications to a degree. So today I wanted to discuss what happens if allergies go untreated for long periods of time. Well, oftentimes nothing happens except the person suffers from allergy symptoms as far as itchy eyes, watery eyes, nasal congestion, chronic sore throat, itchy throat, cough, and sometimes hives, that type of thing. Rarely do people get an anaphylactic reaction, but there can be long-term consequences of allergies if they are untreated as well. So, as I talked about last week, we know that seasonal allergies are a result of the immune system being a little bit overactive and recognizing environmental materials such as pollens, cat dander, dog dander, mold, that type of thing, dust, as being foreign and harmful. And so when the immune system gets activated, oftentimes it starts to become confused as well. So we'll talk about things that can happen in response to overactive immune system, and then other things that can happen in response to just not treating the allergies. So if we talk about kind of routine things that are seen frequently in medical clinics of untreated allergies, one of them would be conjunctivitis or an eye infection. Anytime you're having oversecretion and inflammation of a mucous membrane, it becomes an excellent breeding ground for viruses and bacteria. And so there is an increased risk of eye infections with untreated allergies. In the same response of untreated allergies is an increased risk of sinus infections, as well as nasal infections and ear infections. Again, there is increase in inflammation and histamine release, which causes tissue swelling, as well as increase in secretion of fluids trying to eliminate those allergens from the body. If those secretions get into the eustachian tube and into the middle ear, they can cause chronic otitis media, otherwise known as chronic ear infections. That fluid can become thickened over time if it's not able to drain, and can sometimes result not only in chronic antibiotic use, but sometimes in the need for tubes to be placed in the ears to help facilitate drainage. Chronic sinus infections can also occur. This can lead to thickening of the mucosa of the sinus cavity and sometimes result in sinus surgery or surgery on the nasal cavity to help shrink up the what's called the inferior turbinate hypertrophy, which is the tissue inside the nose that can swell and release fluids in response to allergies. So those are some things that people suffer from that is often treated in the primary care provider office and would be an indicator to refer to an allergist or ear, nose, and throat that also treats allergies to be evaluated and have treatment done. Other issues that can arise from untreated allergies, besides itchy throat, if you are having a chronic cough, that can increase your risk for laryngopharyngeal reflux. Can also increase your risk for developing pulmonary inflammation, which can cause bronchitis. And actually, if you're having allergies that aren't treated over a long enough period of time, and there is a lot of inflammation to the lung tissue, you can develop asthma or even chronic obstructive pulmonary disease in the long term. So it's really important that you get your, the patients have an evaluation of their allergies and discuss different actual treatment options or even treatment of symptoms. Other things that can be seen as far as affecting the immune system when the immune system is on hyperdrive is if the immune system starts to make antibodies against itself. And so some of those areas that can be associated with the body producing antibodies against itself are what we know as autoimmune type issues. So one of the main things that is seen in untreated allergies can be increase in thyroid disorders, such as specifically Hashimoto's thyroiditis, where the immune system starts to develop antibodies against the thyroid. This causes the thyroid to decrease its ability to function and results in hypothyroidism, and the patient would need to take thyroid medication at that point. So that's one of the autoimmune issues that we see, as well as development potentially of lupus, scleroderma, rheumatoid arthritis, and Sjogren's syndrome can be seen in untreated allergies. Other areas we see when the immune system is activated that can cause chronic issues are eczema and psoriasis. There are a lot of people that have chronic psoriasis and chronic eczema, which can be really bothersome and difficult to treat, that is completely related to untreated allergies. And in discussing the skin in response to untreated allergies, with the immune system not behaving appropriately, it also increases risk for bacterial infections as well as fungal infections. And these fungal infections can actually affect the ears as well as the sinus cavity and the lungs. So it's very important for a patient to realize that if they're having allergies, they may not just be suffering from symptoms, but they may be doing some underlying damage by not getting the allergies evaluated and treated. Again, treatment of allergies, the only actual treatments are either complete avoidance of the offending agent or doing allergy immunotherapy via injections or sublingual drops that go under the tongue. So I just wanted to finish up the podcast on allergies with a shorter podcast regarding possible complications that can arise should you not treat the allergies and the allergy symptoms. On a final note, with the complications of untreated allergies, the most dangerous complication of untreated allergies would be the development of anaphylaxis, and that can happen at any time. It's hard to anticipate when someone will have an anaphylactic reaction or not, because people can go years and years and their entire lives without having an anaphylactic reaction, or something can trigger the allergy cascade in which your immune system literally is triggered and mast cells, which is part of the white blood cells, are released in large quantities. They cause the release of chemicals such as histamines, prostaglandins, and leukotrienes, which are naturally in our bloodstream, and that causes our vessels to actually leak. The bronchial tissues start to swell, our blood pressure drops, and we start having significant symptoms of sometimes tongue swelling, difficulty with breathing, and that can be a life-threatening and is, if it's not treated, a life-threatening situation. Anyone who's had symptoms of anaphylaxis or who's had an anaphylactic reaction in the past oftentimes will always carry an EpiPen with them, so that if they are in contact with something that they know is going to cause an anaphylactic reaction, they can take a shot and then get emergency medical treatment immediately. And in fact, if somebody has had anaphylaxis, they should always carry 2 EpiPens with them. In the event they can't get to a hospital within 20 minutes, it's possible to have a rebound anaphylactic reaction and need that second EpiPen. So An EpiPen is not the be-all, end-all to anaphylaxis. It is just a means to temporarily stop that reaction until you can get to until a patient can get to a hospital. That being said, again, it's impossible to tell when somebody's going to anaphylact, especially if they've never had an anaphylactic reaction in the past. And some people never will, and some people will develop an issue. So again, I would encourage anybody who is suffering from significant allergy symptoms or any allergy symptoms in general to seek evaluation by either ear, nose, and throat that does allergies or an allergist's office. And I want to thank you so much for joining the podcast today. This is a short podcast just to give some information on complications that can arise. I appreciate any and all questions or comments, and you can ask us questions on our website at www.evercare.com or email us at www.evercarefamilypractice@gmail.com. You can call us at 505-780-8301 or contact us on Facebook, YouTube, or Instagram. And I'd like to say a special thank you to Serena for listening, as well as Sharon and Valerie, Brad F., as well as Kathy V., Amanda, and all of our listeners in New Mexico, California, Pennsylvania, across the United States, and in India. I appreciate you listening and taking time out of your day to hear what I have to say. Thank you so much, and I wish everyone health and happiness and the ability to pursue whatever makes you happy in life and making your own choices regarding your health care. Next week, we're going to start a series on mental health topic, which I think will be a really good topic to discuss, and it's near and dear to my heart. We're going to do 17 podcasts on that and talk about some areas that maybe some people are unaware of and give some information on not just medication treatment options, because I'm very holistic, but on other treatment options that are available for any type of mental health issue that may be arising in a patient's life. So have a good rest of your week, and thank you very much.